Hello, everyone. Do you like my bunny box right here? Anyway, this video was a long time coming. I definitely had to sit and think on it for a while before I decided to actually film and make it public. So I do have some notes here because we're going to go through a lot of information, okay? So you read the title, you know what this is about. So first, I like to get into a little bit of my history with self-harm addiction. I have been self-harming pretty consistently on a regular basis since about 8th grade. I did get clean in 2020, but I had a relapse last August, and I'm still trying to get out of that. I am currently 31 days clean. Woo! Yay! So today we're going to be going through the criteria for an addiction as described by the DSM5. And non-suicidal self-injury disorder is a physical disorder that is in the DSM-5 already, but I'm also going to be going through their addiction criteria, which is what we are here for today. Self-injury addiction is also treatable by medication, as like on top of the normal like depression meds, bipolar meds, anxiety meds. I actually just got put recently on, I gotta say this word right, naltrexone. Yes. I just got put on that a couple days ago. I'm still getting through the first stages of my body reacting to the medication. I have had a couple side effects, but I have had reduced cravings and self-harm thoughts because of the medication. It's typically a medication given to alcoholics, as my psychiatrist said, recovering alcoholics. But it seems to be working for self-harm addiction as well, and there's definitely a reason she put me on it, because as we are going to discover today, self-harm may very well be an addiction. All right. So also in this video, I want to give a disclaimer. I'm not trying to diagnose anyone or anything like that. If you have an issue, definitely see a therapist or a psychiatrist or someone in the mental health field or the medical field. But I am just going to go through these criteria and state my personal experience with all these. Okay, so it looks like in my notes here, there are 12 criteria, and I will be listing the website that I got these from down in the description, so you can go check it out. The first criteria for addiction is tolerance. And yes, self-harmers do build a tolerance. One very good example of this is depth and like amount. Because like once you cut once at one depth, you will need to cut more or deeper to get the same endorphin response in your brain, because self-harm, cutting, burning, scratching, picking, and anything else in that field releases endorphins like adrenaline, other chemicals in your brain that are going to make that feel like a rush, you know? Okay, so we just went over tolerance. So the next criteria for addiction is withdrawal. And again, when you self-harm, you get these endorphins in your brain. It doesn't feel good, but it feels somehow satisfying to a part of you. And it's just really hard to explain if you've never done it, but it feels satisfying to like just look at it and watch it and experience it. It's a really weird feeling. But withdrawal, you do get cravings once you do it once, because your brain's just like, hey, here's something we could do that won't fix the problem, but might make you feel a little better. But it won't. It's momentary relief. So you do get cravings after you do it, even just once. You do get an adrenaline rush from the moment that the blade or the burn or whatever happens, you do get an adrenaline rush that some people might have a draw to. You might get cravings for it again. Number 3 is hazardous use, and I feel like that's pretty self-explanatory because like self-harm, self-injury, non-suicidal self-injury disorder. Yeah, you are physically harming your body, and no matter what you get around it, like, oh, these bruises will fade, oh, these tiny scratches, they'll go away. But what if that doesn't satisfy you enough? What if you keep coming back and being like, I need to do that, but I need to do it better this time? That's kind of the mentality that you might slip into, is like, especially if it escalates to the subcutaneous fat layer of your skin, whether that's burn depth or cut depth, or sometimes even bruise depth. If it gets down to like you could hit veins, you could hit arteries, you could hit blood vessels, you could need stitches, you could need treatment for burns, you could need doctor's treatment for burns if they're really bad burns. Because what if it starts to not satisfy you as much as the first time? Especially like the stereotypical like cuts on your wrist. Do you see, if you feel your wrist, how thin that area is? If you cut the wrong part in here, you could lose the function of a hand, like the whole function of your hand. So like there's no safe place to cut, but if you're cutting in an area like your neck, or some people, I've seen people like in a way to attempt to hide marks, they'll cut the inside of their mouth, and I'm just like, that's an incredibly dangerous area. Like, do you know how thin, like... Okay, the next point on the DSM addiction criteria is social and interpersonal problems. And I feel like this is, again, kind of self-explanatory. If you really start to think about like what self-injury disorder is, it's a response to depression. Self-injury is often a symptom of a bigger problem, which may include like social isolation or like hiding marks, like not going outside without like a jacket on or something. So yeah, feeling isolated because you have those marks, and like maybe none of your friends have marks, you know, like maybe you're the only one and you feel isolated because it's like, why am I only struggling with this, you know? This is again like hiding tools, like medical supplies or like instruments to do the harm with, like hiding these things. Like maybe you have multiple things stashed around your room. Maybe you have your medical supplies stashed with like your feminine hygiene products or something like that. Again, with that is like, because it is an injury, like maybe like you're hiding your shoulder now, or you're hiding the bandage, or like the physical place on your body you also would hide, because who wants to like tell someone about this? Like, yeah, this could even escalate to like keeping instruments like on your person or in your bag or in your backpack or in your purse or in your pockets, to like, what if I'm out somewhere and I need to get a fix? Like, I've even heard of people like bringing blades to school and like harming in the bathroom because, you know, maybe they get upset and they need it, you know, which is a horrible idea. Please don't bring that stuff to school. Please don't do any of this, you know, like if you can avoid it. This is a side note, but this is also why if you're a parent of someone who knows that's doing this, like it's never a good idea to like take tools or supplies away from someone, because like what if they do harm and they need their medical supplies, or what if like they're gonna get their fix with anything. They might use like a rusty pencil sharpener blade, like if they dismantle it, like they're gonna find a way to get what they need. And if it's not sanitary, it's not sanitary, you know? Like if it can't be the pristine blade that we like sanitize ourselves, or like maybe if it's a snap blade, like, because that can be more safe than doing something else that's really not safe. Okay, so number 5 on this list is neglecting opportunities or roles in order to use. And this can be like not getting like jobs because, oh no, what if we can't wear long sleeves at our jobs or something like that? Or maybe like I'll bring this up again later, but like if you're a lifeguard, like swimming situations, like you being like, oh, I can't get that like lifeguard job because like I'm gonna have to be a little bit more exposed. I touched on this again, but wearing long sleeves and pants even in the summertime could really deny you of opportunities to do things, and like being physically uncomfortable in the summer. And if it's in the time of someone currently using, like maybe you're late because you need to stop the bleeding. Maybe you're late because you need to finish bandaging up your thing. Maybe you need to take more time in the morning and afternoon and evenings to care for this injury on your body. And also time spent getting treatment, time spent going to therapy, time spent going to the hospital to get stitched, time spent in psych wards because people want to put you in there because they think you're crazy. So there's really time spent and opportunities lost in nearly every part of your life because of this. The next point in the DSM5 is using larger amounts or more frequency. And this goes along with tolerance. I think I already touched on this, that like maybe that little cat scratch like won't be enough to satisfy you, or maybe you need to make multiple in a session in order to feel satisfied again. Or even satisfied with the marks too, because like sometimes like if you have like a deep wound, it'll obviously get stitched and closed up, and then you feel like, well, did I even really suffer if it's so small that I can barely see it? Or like proof in yourself to show that you went through something traumatic or that you went through something hard. Like these marks, now that they're healed and they're smaller now, they don't satisfy me because they don't think it's like being worthy to yourself, you know? Like you got to prove something to yourself by these marks. The next point is repeated attempts to control or quit. And this can be in harm reduction, or even like, because you might jump from addiction to addiction. You might go from cutting to burning to scratching to picking to many other forms of harm. You could be like turn to alcohol, turn to drugs, turn to sex, turn to any number of things. You will maybe seek out other things that elicit the same like pain response, or maybe like a common one that I deal with, like if I feel like I can't cut, I might starve myself, because that's another addiction that I've struggled with in the past, is food addiction and controlling food. So like, because starving will cause you physical harm. So many people will be like, oh, well, I can't harm, I will starve. Sorry, I almost mixed up my words there. But at the core of it, nothing feels like cutting does. Nothing feels like burning does. Nothing feels like starving does. Like no matter what you do instead, you will always still want the real thing that you're craving. Or another thing that is really common is, this is where it gets kind of like expensive, because like you'll throw out your supplies, but then what if you need it again? You know, like I keep a stash of like medical supplies, because like what if I need it again? I can't throw it out. I can't throw out, you know, like what if I need it? And that's such like an addictive thing to say. The next point is much time spent using. And I feel like this is a little bit self-explanatory, but once you get going, you might feel like you need to do this multiple times a day, every day, maybe once a week, maybe it escalates, maybe you're only harming once a month and then it escalates, because it starts out as like a response to a problem. Like, oh, my mom got upset with me today, so I'm going to turn to this. And then it feels like you can't live without it. And if that's not a problem, I don't know what is. The next one is physical and psychological problems related to use. And absolutely, because you are harming yourself. You have to get into the mentality of the sufferer. This person is harming themselves often. What do you think is going to happen to that person? They're going to have physical problems related to their wounds. They're going to have psychological problems like depression, anxiety, other mental illnesses. They're going to be upset. That's just the nature of how this works. So this can include, like I said, depression, anxiety, loneliness, eating disorders, any other sort of mental problem could go along with this, as well as the physical addiction. The next point is activities given up to use. And I mentioned before swimming. So like avoiding situations where you might have to show your skin. I think a lot of times about sports, because like if I harmed my shoulder, maybe I can't like do that whatever sport where I need to move my arms at full range of motion. Because it is an injury. So that's very clear fit for this aspect. Again, with swimming, like it's a very bad idea to swim with like something that's starting to scab or attempting to scab, or like they even say like don't take baths with, or like if you take a bath, like elevate the whatever limb you harmed on, because like you have to take care of these things or they're gonna get infected, it's gonna cause you more problems, the whole thing. The next point is using more of a substance than intending. Absolutely. You could accidentally go too deep. You could zone out during a harm session and make more than you were intending. You could pick uncontrollable, like picking, like zoning out and picking at an area. And it's also dangerous if you like combine other substances with self-harm, like self-harming when you're drunk, self-harming when you're high. These could all be very dangerous situations when you're not in the right state of mind to know what you're doing. And even when you harm, it's like something else kind of like takes over you. Like you're not in your right mind when you're trying to get a fix. And the last point on the list is number 12. They had like 2 separate kind of lists and I kind of combined them all. So there was 10, but then there was points that they made later in the article that I kind of added into the list. So this is number 12. It might not line up completely with what is on the website, but I tried to give you the most information that I possibly could. So I'm making 12 points. So number 12 is continuing despite causing problems in physical or mental health. And yes, absolutely. Once you're in it, it's very hard to stop, especially if you have some of these other symptoms that characterize the addiction. It becomes like I said earlier, it starts as like a response to something. And then if you keep doing it and keep doing it, it's almost like you need it to live. Like I need to get this out of the way so that I can do all this other stuff that I need to do today. It just kind of like becomes just what you do, you know? And it obviously, like, it does give you a momentarily sense of relief. And then you just feel worse again because, like, oh man, I messed up my streak, you know, whatever it may be. And I also want to include the DSM5 lists 4 levels of severity with this list. So I'm going to get into that as well. Again, I am not a medical professional. I'm not here to diagnose someone. This is just the information that I was presented with on this website. So I am here presenting it to you all. So if you line up with one of these points that I made, you are in the at-risk category. If you find yourself lining up with 2 or 3 points, you may have a mild substance abuse disorder. And it's not like a substance, but like that's just what they called it on the website. So that's the information that I'm telling you, because self-harm isn't like a substance. It's like a physical thing, but we're trying to relate these substance categories to an action. So that's what we're working with here. So 4 or 5 is a moderate use disorder, and 6 or more may classify an addiction. So, if you find yourself struggling with this, definitely seek out a mental health professional, seek out a therapist. A psychiatrist can get you on medication. A psychologist can diagnose you with a problem. Counselors may help in the short term as well, but they are not going to give you the level that a therapist would. And if you find yourself being the parent or a teacher or whatever, like in a position to advise someone, or you see someone struggling with this in your life, definitely come to them in a place of calm and care. You don't want to get angry with someone about this, because it's kind of like a self-punishment as well. So you don't want to punish or take away someone's things. Definitely don't take away their medical supplies. Don't take away really their anything, because it's not going to help. They're going to do it. They're going to find a way to do it anyway if that's what they're craving. And again, just focus on treating the problem at hand, not the symptom. Self-harm being the symptom, the response to whatever problem is going on in their life. Maybe they're depressed about something. Maybe they're going through some sort of trauma. Treat the root cause of the issue by encouraging them to go to therapy, encouraging them to get some sort of help, or, and honestly, just talking to them like, hey, how are you feeling? I noticed those marks. Like, you want to talk about it? Do you not? Maybe they don't have any friends, you know, like, again, I don't know their personal situation, but those are just the things that I would recommend. And of course, just be kind to someone. Like, anger and hate is never going to make a bad situation better. So, well, bye. That's all I had for you today.